Okay, hi, I'm Steve Main with Fitness for 5 and Fitness for 10, here with Dr. Nario of Biointegrative Health Clinic. So, hello, doctor.
Hi, Steve. Good afternoon. Thank you for the invite again.
Sure, Biointegrative Health is in Reno, Nevada. You can look them up. So, I'm thinking something that I see a lot is like when I go to the grocery store, people as young as 50, when I'd estimate that maybe they're 60 or 70, it seems like 90% of them are limping. And that limp or that pain, it could be coming from their back, it could be coming from joints. But I'm noticing, and it's kind of sad, so many people limping, which means, and you can tell it's from some type of pain. So, what is pain?
Well, that's a good question, Steve. You're just going to a good topic here, since we see pain a lot, especially now in the time of the opiates. And we've been hearing stories about people overdosing on it, abusing it. And that is the reason why pain is a very prominent word nowadays. But not just that, it's very relevant, especially with the changing times now. The world is in a different spot. You would hear about pain not only physically but also mentally. The thing here is defining pain is also defining discomfort, which is caused not only by illness but a specific condition. May it be trauma, may it be a trauma that's mental and even physical. And you have to remember, pain is very subjective. The thing with that is it's different for everybody. When, let's say, you drop a hammer on your toe, yeah, I might be smiling, but you might be screaming and cussing at everybody. And that's why the pain tolerance is something that you have to also consider in this specific definition. And as I mentioned to you, there are different aspects of pain, but let's discuss the two most common aspects of it. One is physical. We always think about bodily injuries. In the back boxing match, slamming the door on the finger, yeah, makes you say verbally, ouch. You scream it out. But the one that another aspect that we don't see, but we only feel, is called emotional pain. And these are the mental, the feelings. And examples of this would be abuse mentally, neglect, even being degraded in a way. These are the non-verbal screams that we don't see. And this is that ouch that's internal, which is for me, as I consider it, the more dangerous type of pain.
Yeah, it seems like it would be. Um, so you've kind of described the different types of pain, but where does it come from? I mean, what causes it? Like I just described it when we first started talking. I
Hmm.
see these people, but just because they're limping doesn't mean there's a problem with their leg. And so, what causes it? What causes pain? Emotional pain. You just said maybe abuse, but
Right.
it's something that I've never experienced, so it's kind of hard for me to relate to that. So can you just kind of
Mhm.
get into deeper on what can cause some of these things, physical and emotionally or mental, and what do you
Mhm.
do about it? What can you do about it? What
Well,
shouldn't
the
you
thing
do
here
about it?
is, right, that is a pretty good question. So there are so many different ways on how you can really go about it. What can we do? There's so many different managements, but let me define to you the different types of pain in order for you to understand it better. So there are two types of duration of pain. One would be the duration of being acute, meaning it's less than 3 to 6 months. This is regardless of may it be physical or mental or emotional pain. And but the thing that I wanted to probably point on more about is the physical pain that everybody feels. Because this is easier, I mean, I don't want to say easier to treat, but it's just more obvious to see. And you don't have to prod on and refer somebody to psychiatry for that. You can see them in the clinic walking around, as you said, with a limp, holding onto their back or holding onto their head if they have a headache. So pain directly, I guess, applied to the tissues, which causes damage. And an example for you would be a paper cut. or a needle prick. And again, let's go back to the common example of the back pain, wherein people carry the heavy load and boom, there goes pain right there. And the thing here is acute pain is experienced before 3 to 6 months. So meaning it heals up, it goes away. But the bigger problem is when the pain persists. This is the definition wherein the chronic pain now is more than 3 to 6 months. This is now becoming more of a problem for the patient, not only for the physical pain, but also now in the head, because it's now being a part of their everyday life. And an example, again, let's go back to our back pain example, is now when you look at your MRI or an X-ray that you see a fracture, you actually see a slipped disc. Now there is a reason for that pain to linger on. And that's why when there is chronic pain, and when it's with an identifiable tissue damage or structural issue, other influences comes into play. This is when you say, I better not exercise because I might be feeling more pain. Thus, you are producing physical deconditioning on yourself. A person might even think of pain about everything now. I don't want to go upstairs. I don't want to do this errand because of the pain that will ensue. And that's why sometimes they won't go out of the house, or they feel sad for themselves. They feel depression and anxiety. And that's why all of these different factors makes the pain worse.
Okay, that's really interesting. So, can you recommend methods of managing pain? So,
Yeah.
How would you do that? And can you just give me some examples of what type of pain and how you would manage it?
Well, Steve, the thing here is everybody in their head, the stereotype treatment would be medicine. Everybody needs to understand, yes, pain medicine is out there, such as your simple ointments. So the one that you apply, capsaicin cream on a painful joint, or even Bengay that has menthol in it. And another step up to that would be your anti-inflammatories, Advil, ibuprofen, naproxen, which are over the counter. And this lowers down the inflammation where the pain is coming from. And the big guns, or the players of pain medicine here, is the opiates. And these are the ones that we hear a lot in relation to addiction, even overdosing. And again, as a provider of practicing integrative medicine, that is not my first go-to. The first go-to are the non-medical methods, which we advocate for, and as I choose as my first line therapy. These are acupuncture, inserting needles through the skin at pain points, physical therapy, treatment for injury through physical interventions such as massage, heat therapy, and even exercise may be active or passive. And another one would be, I'm sure you've seen this before, the TENS machine. It's a transcutaneous electrical nerve stimulation. It's a small battery operated device, and you apply different leads on a specific area where the pain is so that the signals of pain can be modified or controlled. And lastly, one worth mentioning, I'm sure there are more, are supplements, wherein there's herbs, vitamins, minerals, that focuses on inflammation and repair.
Okay, so because I know what you said earlier, I've had back problems here and there, but I'm doing the right exercises and I haven't had back problems for quite a while now. But if it gets up to like a month or two, it will change your mood. It definitely will affect you in every way. You get grumpy, and I'm not really a grumpy guy, but you give me back pain for a couple weeks and I can get kind of irritable. So I just wanted to say that kind of makes sense to me. So you talked a little bit about supplements. So last question, is there any type of supplement or herb that you would recommend for pain? Like, I don't know, any herb or anything that maybe could help.
There are, Steve. The thing here is now you have to define, again, as I want to, in relation to supplementation, I always want to classify first the type of pain, acute pain and chronic pain. Well, now we're talking about more of the chronic pain, which affects the different parts of our holistic aspect, the mental, the emotional. When I want to manage chronic pain, I always want to make sure I have this at hand. One is Boswellia. Boswellia is actually it's a part of a tree where frankincense gets extracted from, and the extract, I mean the extract or the part of that tree, actually has the function of inhibiting the creation of inflammatory enzymes that aggravates pain. And if you most of us will get this over the counter or even through supplement stores. You can get this in 100 to 250 milligrams and take it once a day through mouth. And also, it addresses usually the pain and inflammation of arthritis. So if you have been overworking your joints, exercising a lot, that's the wear and tear, and that's where arthritis starts. Another one would be cat's claw or una de gato. It's known for the infection function, but now we're going to talk about the plant which can interact and numb up the pain receptors in your system. And this is usually most for, again, osteoarthritis, the rubbing of the joints, and also rheumatoid arthritis with the deformities of the hands and systemic affectation. It's taken 100 milligrams daily, and it's only safe to be taken only for a short period of time. And my suggestion is take it for 4 weeks. Another one would be CoQ10. This is a story that you would hear all the time when people are taking statins, when they feel that, oh, my muscles are aching after me taking that specific cholesterol pill called a statin drug. The reason for that is statins depletes the mitochondria, and in the mitochondria is the creation of your CoQ10. That's why this is something that is a must to have when somebody's taking a cholesterol pill. The dose would be 100 to 300 milligrams a day. So the difference here, as you can see, is between chronic and acute pain is for chronic, you have to be maintained on these supplements. It's not just going to be for the duration of when you have pain. And for the acute story, you can only take it when the pain is there, and if you wanted to control it during that specific period of time. So it's all about maintenance for the chronic pain person or patient.
Wow, great information, Doctor. Thank you for your time, Dr. Nario, Biointegrative Health Center in Reno, Nevada. So until next time, thank you, Doctor.
Thanks, Steve.